evidence-based program actually is not on tobacco program. Smoking is one of the main public health issues in the United States. It almost remains the leading cause of preventable morbidity and mortality. According to the National Youth Tobacco Survey in 2014, 2.5% of middle school and 9.2% of high school students smoked cigarettes in the past 30 days, while 3.9% of middle school and 13.4% of high school students report current electronic cigarette use. So young people can become addicted to smoking very early. Despite the willingness of many young people to stop smoking, they do not always succeed. In recent years, youth uh, smoking has been elevated to a national health priority. National organizations and experts have joined together to emphasize the importance of evaluating, understanding, and reporting youth smoking and cessation efforts. The Not on Tobacco program is an evidence-based, requiring teen smoking cessation program designed for 14 to 19 years old regular smokers, involving school and community participation at all levels. In this study, the target population was the daily adolescent smoker for 14 years to 19 years across West Virginia. This study used the RING framework to evaluate the impact on tobacco in West Virginia from 2000 to 2005. First, the author assessed the public health impact of NOT in West Virginia. Then they examined the impact of place of assessing the comparative public health impact of NOT among regional service agency region in West Virginia. This results provide an understanding of the regional, the geographical context that affect the dissemination of NOT program in West Virginia. The use of the RING framework provides a more comprehensive program assessment than the more common efficacy evaluation, which findings reveal that not to reach the intended audience of daily adolescent smokers within the 14 to 19 years age range across West Virginia. Important differences were found in teen social and family contexts. Social factors such as poor tobacco period and household influence, as well as tobacco advertising and promotion, are powerful factors which can move the perception and attitude of youth toward tobacco use as normative. Participants observed smoking more often among friends than parents and siblings. So, what is the effectiveness of the Not on Tobacco program on control tobacco among teens? Assessment of effectiveness was based on participant smoking outcome, defined as a favorable change or quit rate at the end of the program. Overall, about 20% of West Virginia Not on Tobacco participants report quitting smoking at 3 month baseline. Despite reaching the intended audience, the absolute reach was alarmingly low. This may be partially due to the lack of implementation among trained facilitators. It may be necessary to tailor programs such as NOT to make them more consistent. Cessation programs tailored for youth may need to consider topics such as tobacco growing economy, favorable tobacco environment, and favorable norm about use, geographic relation, and lack of access to service, cultural and traditional values and customs, poverty, as well as new patterns of tobacco use, such as electronic cigarettes. Net quit rates show a positive upward trend for 5 of 8 regions. These findings support future examination for regional factors that may influence program effectiveness. Therefore, geographical tailoring ground and community-based participatory research could increase the program overall dissemination. Public health in the United States is composed of federal, state, tribal, and local health governments and a network of both government and non-governmental organizations working to create conditions that allow people to live healthy. This article describes how partners work together to bring the NOTs into fruition in West Virginia. From 2000 to 2005, the West Virginia University Center for Public Health Research and Training, in partnership with West Virginia State Health and Education Department and the American Lung Association, designed, evaluate, and disseminate knowledge on tobacco program in West Virginia. 8 of these are contributing to the success of the program. The West Virginia University, the West Virginia State Health Department, and the American Lung Association brought scientific experts to train facilitators while West Virginia Education Department provided the high school where the program was evaluated. The study used a database of high school smokers of both sexes collected from 2000 to 2005 in West Virginia. The study used a ring framework to evaluate NOTs at the state level and the relay to evaluate and understand the geographical context that affect the dissemination in North and West Virginia. The NOT program is an evidence-based regarding smoking cessation program designed for 14 to 19 years old U.S. smoking in boarding school and community participating at all levels. This is also widely available across the United States. It was developed through a partnership of the American Lung Association, the U.S. Department of Education, and the Public Health. A decade of research indicates NOTS program is cost-effective, adaptable, and suitable. This intervention is particularly important because it targets all non-smokers in both rural and urban areas with a focus on at-risk groups such youth from relatively impoverished rural areas with higher risk for developing smoking-related chronic disease later in life. The most of those NOTS programs have been funded through grants from partners such as the West Virginia Bureau for Public Health, the National Trust for the Center for Disease and Prevention, and the Substance Abuse and Mental Health Service Administration have recognized the Latin Tobacco Program as a research effective program. In the United States, law established a minimum age of legal access for tobacco at 18. Some states, like Hawaii, raised their tobacco annual age to 21. Purchase or attempt a purchase of electronic cigarette or tobacco products by a minor under the age of 18 is almost prohibited by law. Unfortunately, the Latin Tobacco Program was designed for youth age 14 to 19. Thus, minors were allowed to participate on a NOT program to feed the species. In the NOT program conducted in Alabama high school, the investigator provided informed consent letter to the student or their parent. In this letter, which the investigator mailed directly to the parents, those who did not want their child to participate were asked to tell the child that he or she should join the program. In West Virginia, this program was approved by the Institutional Review Board at West Virginia University. The tobacco industry claimed to support restrictions on youth access to tobacco, but has consistently advocated against increasing the minimum age of legal access to 21. Smoking tobacco was developed as gender-specific high school-based smoking cessation program. It is described as a total health approach to smoking cessation, especially among disparate or high-risk subgroups. One notable high-risk group is youth from elected and of rural areas. Tobacco-related health threats are particularly alarming for those high-risk subgroups like American Indians. Ultimately, the identification of those factors led to development of this program, and the results have been published on a large scale in prestigious scientific journals. Findings suggest that the knock on tobacco is one option for long-term smoking cessation among rural teens. Some studies also reveal high quit rates among urban centers of youth. In the short term, the NOT program show favorable change in smoking behavior. In long term, it has enabled young people to have a better quality of life by preventing them from serious tobacco-related illness. Level NOT program use standardized evaluation procedure and protocol and train facilitators, and data were obtained from the American Lung Association. The NOT is the only smoking cessation program for adolescents that include an adaptation specifically for youth such as American Indians. For all those reasons, this program can be adapted to all